Hello and welcome to The Vaccine. I'm Jeremy Fernandez. The troubled vaccine rollout in Australia is struggling to overcome rising vaccine hesitancy. It seems some people are worried about potential side effects. There's also a lack of urgency because there are now so few outbreaks through community transmission here. On top of that, there have been some mixed messages from the federal government this week suggesting that anyone who's apprehensive about taking the AstraZeneca vaccine could wait until more doses of Pfizer's and Moderna's vaccines come online.
Right now, we want to encourage everybody over 50 to be vaccinated as early as possible, but we've been very clear that as supply increases later on in the year, there will be enough vaccine of mRNA vaccines for every Australian.
That's Greg Hunt there. Now, ABC analyst Casey Briggs joins us now. Casey, how is the rollout looking here?
Yeah, hi Jeremy. Well, we're still not really at a pace that will see us get to full vaccination across Australia by the end of this year, even next year. But we have, at least just in the last 24 hours, seen a day with more than 100,000 doses administered. This curve is picking up slowly. The 7-day average is around about just under 70,000 doses a day at the moment. In terms of the states, or the state governments at least, the New South Wales government is picking up this pace the fastest, has the steepest curve of new doses at the moment, while doses delivered nationally through general practices, through the federal government program, they're virtually at a bit of a flat line. Nationally, we've got 3.5 million shots delivered to date. Still can't tell you how many Australians are fully vaccinated against COVID-19 because, unlike most countries, that is still not information that our national authorities are publishing. At least we still have no local cases because, you know, remember, the longer that we go with a largely unvaccinated population, the higher the risk that we'll continue to see more outbreaks. Remember Thailand? That was a country that through all of last year was regarded as, you know, near top of the class in its response. Virtually no cases through the entire year. Now they're dealing with, sadly, a serious wave that's growing at the moment. That's a big number there, 9,600, but still more than 4,000 cases a day on average in Thailand, and deaths are growing there as well at the moment, 700 at the moment. A lot of those are happening in just the recent days and weeks, as we can see, you know, more than about 30 a day at the moment. That is just one of many waves around that region, Southeast Asia. Let me show you Malaysia as well, where we're again seeing nearly 500,000 cases now and an average of more than 4,000 cases a day at the moment. In fact, Southeast Asia and Southern Asia, that's responsible for more than half of all of the cases that we're seeing around the world at the moment. That is driven largely by the ongoing crisis in India, but some nasty looking waves in other countries regardless. We're also seeing a bit of an increase in South America at the moment. More than half of those cases are in Brazil. The curve had been improving. The situation looked like it had been improving there. That sadly no longer looks like it's the case. In fact, we may be beginning to see an increase, but certainly a plateau of cases around the 80,000 mark.
Casey Briggs, thank you. Well, Dr. Norman Swan is the co-host of the ABC's Coronacast podcast, and he joins us now. Norman Swan, you don't have to look very far to see that Australia is very lucky through good management and good luck at the same time here in Australia, and that a byproduct of that means that we're seeing this hesitancy around in Australia. How much of that can be blamed on the government's mixed messaging?
Well, the government's had bad luck itself with the Astra side effect, and that hasn't helped anybody. But they haven't necessarily helped themselves by not necessarily having a good marketing campaign to help this along. And mixed messages like the health minister yesterday, he walked that back during the day. He probably didn't mean to say it. It doesn't help either. So there's a lot going on here. And the other problem is the rollout. So if you actually reframe it, Professor Julie Leask at Sydney University talks about reframing this. If you really reframe it as people who are intending to get vaccinated. So maybe 65% of Australians intend to get vaccinated. Then there are other people for whom there are other reasons why they're holding off. There's only a small proportion who will never get vaccinated. So they're holding off. One reason they hold off is that they're confused, and that is the government's fault, about how the rollout is happening. They phone up a GP and they can't be seen till September or August, and then there's a GP free around the corner, they don't know where to go. It's not been rolled out in the way that normal vaccine campaigns are, such as influenza and so on, where the state governments tend to run it, and what all the federal government does is it provides the vaccine to the states and they distribute it. This has been done in a very complicated way with private contractors, and very few people with disability have been immunised. And so people say to themselves, well, how do I do it? How do I actually get there? So it might be as simple as that. And then there's the issue of some people wanting to wait for Pfizer. And that's an important issue to be dealt with, because it's fine, you can wait for that, but we are at risk. We do not have hotel quarantine that's fit for purpose. We have a high rate of leaks relative to the number of people coming in who are infected, and more infected people are coming in. The 617 variant, which is the Indian variant, is about 40% more infectious, almost certainly, than the British variant. So remember the Wuhan virus, the original one? One person, if there were no controls, infected 2.4 other people. The British one, it's 4.5. And it looks as though an Indian variant is 6 or maybe even as high as 8. That's how contagious it is. And maybe is a little bit vaccine resistant. So if that gets into the community, and we've already had it, so the Indian variant got into New South Wales and in Victoria, and we're just lucky it didn't spread and could spread quite fast. Do we want to live on edge like that? And the other problem for the over 50s is that if you are waiting for the Pfizer vaccine, you're going to be at the end of the queue behind 12-year-olds. They're going to immunise 12 to 50-year-olds before they get to you. And it could be well into 2022 before that happens.
You talk to friends and family, and you read the comments in our social media feeds, and you see people really hung up about this distinction between under 50s and over 50s taking what's perceived to be an inferior vaccine. That seems to be a cause of a lot of the anxiety about the reluctance to go forward.
So very quickly on this. There's two issues here. One is why 50, and there's two moving parts. I think we've talked about it before. So over 50, your risk of dying of COVID goes way up, but also your risk of the vaccine goes way down. So the risk of the vaccine, if you're under 50, is maybe 1 in between 20 and 40,000 doses. Over that, it's 1 in 87,000 doses. One person in the MCG, is really what we're talking about here. Not insignificant, you're not denying that, but it's a low risk. That's the first thing. The second thing is the effectiveness. The people still have in their minds the original presentation of the clinical trials of Astra, where when it was given 4 weeks apart, they got 62% efficacy. But in fact, when you give it 12 weeks apart, it's up there almost at the same level as Pfizer. And when you look at the performance of both vaccines in the real world, they both protect, even with the variants at the moment, they both protect almost 100% of severe disease or going to hospital. Of any infection, Pfizer's at about 95% and Astra is about 85%. That's not a big difference between the two. If you look at any infection at all, asymptomatic, the chances of passing it on, after the first dose of Astra, it's about 60% prevention of any infection at all. And it's a bit more than that for Pfizer. So it's like wearing a mask after the first infection. And then after the second, it goes up to 70 to 85%. So they're not perfect, but they're both performing quite similarly when you look at the really big data coming out of Britain particularly.
Norman Swan, good to talk to you. Thank you.
Pleasure.
Associate Professor Sanjaya Saninayako is an infectious diseases specialist at ANU, and he joins us now. Sanjaya Saninayako, welcome to the program.
Hi Jeremy, how are you?
Now, I know you work a lot with doctors on the ground and trying to combat hesitancy. It's not going as well as expected. Why is that?
Yes, you're quite right, Jeremy. This rollout hasn't gone as well as we have planned. Now, there are a few reasons for it. First of all, with the AstraZeneca vaccine, we are seeing a rare side effect. So this 1 in 100,000 risk of clotting. But the problem, of course, is that we're not hearing it with the other vaccine that has been used in Australia, the Pfizer vaccine. So even though this is a rare side effect with the AstraZeneca vaccine, we're not hearing about it with the Pfizer vaccine. So I think that's one thing playing on people's mind. And I guess it's also the nature of the media as well. And certainly it's not a criticism, but the media tends to report on extraordinary things rather than ordinary things. So you won't say there wasn't an earthquake in Canberra today. Those sorts of things don't get reported. So you'll hear that there was a blood clot today, and you don't hear about the 500,000 cases in 10 days that weren't associated, 500,000 cases of people who received vaccine who didn't get a blood clot. So that's one issue as well. The other thing, of course, is Australia at the moment does not have community transmission of COVID, which is a wonderful thing in so many ways. But combined with the 1 in 100,000 risk of a clot with the AstraZeneca vaccine, people are hesitant. Now, we've seen in Taiwan, a country who, like Australia, has controlled COVID really well, what can happen. They've got a very low vaccination rate, and COVID has been introduced into the community. They're having about 300 cases a day now, and they're going into a lockdown. So that's the danger here. We can go from having no COVID to having widespread community transmission in the blink of an eye. And then trying to mass vaccinate everyone when there's a lot of COVID around, that becomes complicated, Jeremy.
So, some doctors are saying maybe there should be a better advertising campaign, better promotion. Would that fix it in the US? They've got Dolly Parton. In the UK, they've got Elton John. Would an advertising campaign make much of a difference in Australia?
Look, I think so, because there are certainly a group of people who will never have the vaccine. They have decided that is it. But there are a lot of people who are on the fence. And we know that that group of people, that proportion in surveys has increased compared to a few months ago. So there was an ANU survey of a few thousand people which showed that only 13% of people were either completely refusing or were hesitant about the vaccine. And of course, on this recent survey that came out this week, that figure is much higher. So there is an opportunity, I think, if you really put the risk of the vaccines in the context of COVID globally as well as in Australia, that we can get to people so that they can understand the picture more fully and hopefully make a decision to get the vaccine. And I think there is a big opportunity. I mean, election style ads where both the opposition and the government agree that on the same message about vaccines. And we can be innovative too. Now, in Ohio, for instance, the governor there has created a lottery, a vaccine lottery. So for everyone who's been vaccinated, they can enter this lottery, and 5 people will get $1 million each. So it's a $5 million lottery. Krispy Kreme donuts in the US, they were offering a free donut for people who could show that they've been vaccinated. So there are lots of ways to get people to understand and accept the vaccine.
Now, for those who do accept the vaccine, early on there was a fair bit of confusion about, because people were encountering these supply issues. Have those now been curbed?
Yeah, so now we have, with the AstraZeneca vaccine, we've got CSL in Melbourne producing large amounts of vaccine, about 1 million doses a week. And the vaccine can be stored in vaccine fridges for up to 6 months. So supply should not be an issue from that point of view. Now, for the other vaccines that we're waiting for, the Pfizer and Moderna ones, they are still some way away. They're meant to be coming towards the end of the year. Hopefully they will come sooner, but it looks like they're coming towards the end of the year. The other company with which the government negotiated a contract, Novavax. Now, Novavax, we'd hoped by this month that they would be applying for emergency use authorization with the US FDA for their vaccine, because their phase 3 trials would hopefully have had good results, but they've delayed that possibly till about July. So we probably won't see that vaccine for a few months either, if the phase 3 results are good.
Now, just very quickly, there seem to be some figures suggesting that this year fewer people are getting the flu shot compared to last year as well. Why is that?
Yeah, so people particularly aged 18 to 64 at this time of the year compared to this time last year, we've seen a big drop in people getting the flu shot. So again, that could be pandemic weariness. I think people were very scared, very nervous, and very worried about what COVID and flu together might bring. But of course, for various reasons, I think social distancing being one of them, and a lot of people getting vaccinated, we didn't have a big flu season. And that might be giving people the wrong idea that this season will be fine with regard to flu.
And that is the show for this week. Thanks for your company. Goodbye.